Imagine being an essential worker at the beginning of the COVID-19 pandemic. You begin to feel some of the symptoms that you have heard are caused by the virus, and you want to get tested for the safety of your family and community. However, you live in a rural area and cannot acquire the transportation to reach a testing site located miles away from your home. What do you do? Unfortunately, this is a question that many Americans face at the height of the pandemic and continue to struggle with. Over 49 million people in the United States live in rural areas, many of whom are members of historically marginalized populations. With far fewer testing sites and historic discrimination in the healthcare system, Black and Latinx individuals were facing drastically high rates of COVID-19 infection. As long-standing inequities in access to health services were brought to the forefront, it was clear that we needed to reach these individuals to control the spread of the virus and ensure health equity. A solution lies in the four wheels of a large van. A mobile health clinic is a form of care delivery where health providers deliver services to rural communities with a focus on serving historically marginalized populations. They often employ community health workers, building trust in Black and Latinx patients. Mobile health clinics address many obstacles to care delivery, most notably transportation and geographic barriers. This approach has been used in isolated incidences across the United States and North Carolina for not only COVID, but other health conditions. However, these mobile units were not expanded enough and were vastly underfunded, contributing to the current trends in race and ethnicity data. Had a coordinated mobile health clinic initiative existed before COVID, providers would have been able to reach rural areas with COVID-19 tests and now vaccines, slowing the spread of the virus and addressing the many racial and ethnic disparities we see today. Evidently, state governments need to incentivize health systems to invest in mobile health clinics and allocate funding to these initiatives. Stakeholders must work with community leaders to build this infrastructure and reach communities in need. Not only can these clinics provide COVID-19 testing and vaccines, but they can also offer preventative screening or treatment for other health conditions. With the proper support and coordination, mobile health clinics have the potential to solve many of the barriers associated with COVID-19 and ensure a more equitable healthcare system in the future. Thank you.